In the beginning, I'd like to thank to our beloved friends, Sir Ian Chalmers and Dr. Carl and Dr. Paul and the rest of the group who are running this activity in favor of Palestine and especially Gaza. Today I'm going to speak about the development of evidence-based healthcare in the Gaza Strip. In the beginning, I'd like to give an overview of the Gaza Strip. Gaza Strip is a tiny piece of land that is located along the Mediterranean Sea, around 365 square kilometers, with around 1.8 million people, inhabitants. Okay. Around 75% of the population are refugees, with an average income of $1,500 every year, which is unfortunately less than Rwanda. 22% of Gaza homes are not connected to any sewage system. More than 60% of the population are living in poverty, with 30% in extreme poverty. Gaza Strip has been subjected to a massive amount of attacks and wars during the last 50 or 60 years. In 1967, Gaza was occupied by Israel. The first Intifada started and lasted till 1993, when the Oslo Agreement was signed, which left thousands dead and thousands injured. In the year 2000, the second Intifada started and lasted till 2005. Another 1,000 or more died and many, many homes were demolished, but ended in the Israeli withdrawal from Gaza Strip. But Israel retained full control over sea, land, and air over Gaza Strip. In 2006, we had the first democratic election when Hamas won that election, and after that, no one recognized the government and the siege started in Gaza. Unfortunately, in 2007, the internal fighting started, which ended in total control of Gaza Strip by Hamas. After that, the siege became even more stricter and more harsher. Due to this siege, more than 30% of the essential drugs are not available in Gaza, and more than 20% of the consumables are not present in Gaza. Many medical equipments, spare parts are lacking. There's unstable power supply throughout Gaza Strip, with more than 95% of water supply in the Gaza Strip is unsuited for human consumption. So many people died, so many people lost their lives, so many people lost their homes. Gaza has been subjected to wars after wars. 2008, the first war, 2012, the second war, 2014, the third war, which left more than 2,200 Palestinians dead and more than 12,000 injured. So many homes were demolished, so many streets were uprooted, the infrastructure is totally destroyed. Medical care in Palestine is just like any other place under occupation. It's been hampered by occupation, by restriction, by lack of free movement and free establishment of colleges and universities. In 1994, we have the first medical school that has medical school, which is Al-Quds University. In 2007, we have Al-Najah University, also in the West Bank. In Gaza, we have two medical schools. We have the Islamic University, which was established in 2006, and Al-Azhar University, which is a part of Al-Quds University and started in 1994. The curriculum in all schools is just traditional, with no integration between clinical and basic sciences, and little emphasis on problem-based learning and evidence-based medicine. We have the two schools with around 50 students in every school in average. Of course, maybe the biggest in Gaza is the Al-Azhar University. In Gaza, we have around 4,000 doctors, graduates from different countries, some from British system, others from Egyptians, others from Western countries, and others from Eastern countries. There is limited postgraduate training available in Gaza, and if there is, it will be available in Egypt, in Jordan, and in Turkey and Qatar. Traditional training here in Gaza has started, and at the moment, the Palestinian Medical Council runs 10 specialization programs in different specialties since many years, and that has supplied Gaza with a lot of specialists in different fields. Unfortunately, the system of training is also traditional, with little emphasis on evidence and appraisal of that evidence. The quality of under and postgraduate education usually follows the traditional system with no problem-based learning and no emphasis on the search for better evidence for any intervention. Now let's talk why we need evidence-based medicine in Palestine and particularly in Gaza. As I've mentioned, Gaza has been subjected to a lot of wars, bombardment, siege, and stricter siege, lack of movement. So the resources are limited, the financial situation is very dire, the people health is affected by every aspect of their life. Therefore, we need to use the best available evidence to maximize the use of our limited resources. And for this reason, we need to have evidence-based medicine in the Gaza Strip. But we have many obstacles, like any other place. But here the obstacles are even further because of the occupation and the siege and the lack of infrastructure and the lack of movement. And we don't have any postgraduate education in that field. In 2011, an initiative was taken inside the the Faculty of Medicine, the Islamic University, to start some sort of official evidence-based medicine healthcare unit. And actually it was started 2 years prior, but it started in a humble manner by introducing some lectures about evidence-based medicine and some conference presentation in various conferences to doctors and medical students. In 2010, we started with 2 workshops that was held for senior doctors and hospital directors and decision makers, just to introduce the concept of evidence-based medicine. This has encouraged us a lot because we found a lot of encouragement towards learning more about evidence-based medicine, and it showed us that Palestinians really are eager and thirsty to learn more about evidence-based medicine, which pushed us forward to establish the unit in 2011. During that year, we published the first commentary in the Lancet about evidence-based medicine unit in Gaza. At the end of 2012, we have the first Lancet abstract writing workshop held in our medical school. At the end of that year, we held the first Cochrane review, and it was published about the management of white phosphorus burns here in Gaza. In early 2013, we have a workshop to introduce the doctors how to appraise certain articles on practical issues that we are doing here in Gaza. So we selected 15 themes or 15 issues that we are managing here in Gaza, and we tested our management whether it is based on best evidence or not. And we concluded that with the first conference, which was held in the month of October of the same year. That conference was one of the biggest and most successful conferences that we held in our school here. It was attended by 500 doctors and practitioners, with participation from doctors from the United Kingdom and United States, and a big team from Oxford University who attend by person here inside. The goal of the conference was mainly to promote the principles of evidence-based medicine to a larger audience. Second, to improve our practice in that 15 areas of clinical practice. And as I mentioned, we have trained those doctors in the different subcommittees how to search for best evidence and how to compare our practice with the better practice that is based on evidence. The results showed that we are in only 5 themes we are concordant with evidence. In the rest, we are somehow away from that evidence, which shows that we need to improve our practice in various fields. And these recommendations have been distributed to all doctors who attended the conference, and hopefully have changed the practice and was reflected positively on the health of the people. So in conclusion for the conference, we concluded that the conference was a success because it really succeeded in promoting the concept among larger audience, and it has improved our practice in 15 themes. What we aim for the future, we aim to continue our dissemination of knowledge about evidence-based medicine throughout Gaza Strip and other medical schools. We hope to continue organizing EBM training workshops for practicing doctors and decision makers. We hope to link up with various regional international centers for evidence-based medicine and evidence-based healthcare for further training and education and exchange of ideas, hopefully to boost the health of Palestinian people. Finally, we hope to integrate the basic and advanced concept of evidence-based medicine and research appraisal inside our curriculum. When I say the curriculum, I mean the 6 years of our curriculum, starting from year 1 till year 6, with an increasing intensity of training in every year. Finally, I say, despite despair and despite wars, we will work for a better and brighter tomorrow, and thank you very much.